Hello, I'm Jeanette Wider, and I'm managing editor of Healthcare Innovation. Today, I'm here with Fred Morton from Mimecast. Fred, why don't we begin by you introducing yourself, your title, your background, your role, and maybe a little bit about Mimecast too for our audience.
Absolutely, Jeanette. Again, my name is Fred Morton. I'm with a security strategist with Mimecast. So my role at Mimecast is to provide customers, provide prospects with insights into whatever their needs are within their organizations from a cyber resilience and cybersecurity perspective, specifically around email. I've been with Mimecast for about 8 months now. I've been within the IT sector and within healthcare for 20 plus years, with about 12 of those years being within healthcare.
Great. Okay. So today, let's talk a little bit about ransomware. And by now, everybody knows what ransomware is, but would you provide us with an overview?
Sure. Ransomware is a type of malicious software that's been designed to encrypt data stored on devices. It holds the data hostage until the ransom is paid to the cyber criminal, and then the decryption key is provided, allowing the victim to access the files in most cases. Now, notice I said most cases. It's not uncommon for victims to pay the ransom, receive the decryption key, but are still unable to decrypt the files. Now, not only are attackers encrypting files, but recent ransomware versions of the software enable them to copy the data, and then the cybercriminal then threatens the victims with releasing the data to the public. And this is what's known as double extortion. The latest trend now is triple extortion, where not only are records being threatened to be released for additional payment, but with triple extortion, attackers are targeting customers and their suppliers.
Wow, that's I haven't heard a lot about that yet. That's really interesting. But with 2021 now, just a few months behind us, what trends in ransomware did you see develop over the past year within the healthcare sector specifically?
Sure. We saw a month-over-month increase in the continued escalation of attacks on hospitals, covered entities, and their business associates. Now, according to Mimecast State of Email Security and Healthcare Report for 2021, 72% of respondents experienced a ransomware attack in the last 12 months, 30% of those paying the ransom and recovering their data. 32% of those surveyed paid the ransom but didn't recover their data. Then you also had 35% that didn't pay the ransom and were able to recover their data. What was really interesting out of this report were the executives that were surveyed, and they believed that web security and endpoint protection were the most critical defenses against ransomware. But when they were asked what the primary source of ransomware attacks were, they said phishing emails with malicious attachments or links were the source. Now, hearing this stat revealed this was a definite area of opportunity for improvement that could be taken out of 2021.
As hospitals across the United States continue to wrestle with almost 2 years of COVID-19 and its variants, are ransomware gangs still targeting healthcare?
Janet, not only are they still attacking hospitals and their business associates, but they've also stepped up their attacks on healthcare. They understand that covered entities provide critical services and that hospitals have been found to pay ransoms at higher rates than some other sectors. Just this month, the NSA and the FBI released an advisory warning of the increased global threat of ransomware. The advisory warned 14 of the 16 critical infrastructure services, which includes healthcare, are seeing a proliferation of ransomware attacks due to the availability of malware kits and their constantly evolving techniques. A combination of the growing numbers and use of ransomware as a service providers and the initial access brokers that sell stolen credentials of employees has created a globally distributed criminal enterprise that's becoming increasingly difficult to contain. We also can't ignore the impact of the Great Resignation of 2021 that hit the healthcare sector especially hard. I recently interviewed a travel nurse that works in healthcare organizations of varying sizes across the country to augment staff. And she told me it was not uncommon to go into a facility and the charge nurse would be the only full-time hospital employee assigned to the unit. 2 of the 4 patients she was assigned were intubated, and it was also not unheard of to work a 13 or 14-hour shift. Because of COVID-19, this is not an unheard of scenario. and it causes nurses to leave their jobs and take the security awareness training and best practices unique to that hospital with them outside of the organization, which places hospitals at an increased risk.
Do we have any idea who's responsible for these attacks?
In 2021, groups like Fin12, R-Evil, or Revil, and DarkSide were some of the primary players. But now with the current geopolitical climate we're seeing, nation states are stepping up their attacks as well. And like we previously mentioned, ransomware as a service has made the ease and price of entry in the space so low, anyone with minimal computing skills has the ability to launch a ransomware attack these days.
Maybe for our audience that isn't as familiar with a nation state, can you please explain what that is?
Yeah, a nation state is a government-backed entity that has political aspirations, and they use cybersecurity as a means to achieve a political end. Quite often, we're seeing attacks coming from North Korea, Iraq, and Iran.
Okay, so given that ransomware-like viruses have been around since 1989, why are we still dealing with this?
I see you've done your research. The first ransomware virus was released back in '89 and was spread with a floppy disk. And to regain access to your files, you had to send $189 to a PO box in Panama to get the decryption key. Now, since 1989, computers have become interconnected. Cryptocurrencies enable the anonymous transfer of funds, and the ransomware as a service toolkits I mentioned earlier make it easy to execute an attack. Not to mention the average ransomware demand in 2021 was $570,000. Now, the picture should be a little clearer as to why we're still dealing with it.
Right. So, are there any best practices that reduce the likelihood of a hospital falling victim to a ransomware attack that you could share with us?
Yeah. First, ensure your organization has policies, procedures, and standards of conduct in place that establishes the organization's support of best practices and also discourages the behaviors that lead to the introduction of ransomware into your environment. You should also adopt a cybersecurity framework like the NIST CSF or high trust frameworks that provides you guidance on controls you should have in place in order to demonstrate you're exercising your due care or due diligence in your hospital environment. Practice ransomware tabletop exercises. That includes representation from all areas of the hospital. I can't stress this enough. Not just IT and cybersecurity participating in those exercises. These exercises should include nurses practicing their downtime procedures and using hard copies of patient data. You should implement a third-party risk management program for all vendors and business associates that come in contact with hospital data. At minimum, annual risk assessments should be conducted to determine the level of risk your partners are introducing into the environment. Now, from a technical perspective, you should start beyond your email perimeter by implementing DMARC. That's DMARC, and that stands for Domain, Authentication, Reporting, and Conformance. Now, in other words, this setting that you implement on your servers has the ability to prevent domain impersonation attacks and phishing emails. Another solution is brand protection. Now, this is the ability through machine learning and artificial intelligence to scan the internet for websites that may be using your branding and lookalike domains to stage attacks against your employees or business associates. This service not only allows you to be aware of the attack, but they typically offer a takedown service as well on those malicious websites. One of the most important parts in considering that email is the #1 vector of ransomware, you should harden your email perimeter with a purpose-built secure email gateway. This solution should have the ability to not only scan emails from the outside coming into the organization, but also messages that move laterally inside your organization, and that's employee to employee. Leverage a solution like browser isolation that reduces the likelihood of a drive-by download. Browser isolation allows hospital staff to interact with websites in a secure container that keeps infections from reaching their devices or hospital network. Keep good security patch hygiene. Maintain a regular patch cadence and have procedures in place to be able to deploy emergency patches on short notice. With hospitals now averaging 10 to 15 network medical devices per bed, it's imperative these efforts are coordinated with your biomed department as well. The last one, and most important, is to keep offline encrypted backups and test them regularly, or make sure your resume and LinkedIn profile are up to date.
Right. So this is a great segue into my next question. How do we enable non-IT hospital staff in the fight against ransomware? Everybody's not working in the IT department. So do you have any tips for our audience on that?
Yes, you should enable them through the use of really good security awareness training software. Do your due diligence, do your research, and find security training that emphasizes short learning sessions and that's very interactive and engaging. I mentioned the travel nurse earlier in our talk, and she confessed to me that during some of her training sessions, in order to get to the floor as quickly as possible as a travel nurse, she would set up several computers in the area and have the training modules running all simultaneously so that she could get through the sessions quickly, and also to check the box that she was done. So you can see what risk that introduces into the environment, given that you have a travel nurse that's learning the unique training modules that are specific to that hospital. So keeping your users engaged, also conducting phishing exercises where you send the hospital staff emails that are not dangerous, but still come in the form of a phishing email, and test them to see if they fall for the phishing attack, and then coach them up accordingly.
Actually worked at an organization in my career that did phishing emails. And if you didn't report them, you had to do extra training, which was very effective in my opinion. So I have another small question. It's related to, non-IT staff and maybe IT staff that are working at home now. It's almost like the new perimeter is home because of COVID-19. Do you have any tips for our audience on, you know, um, perhaps workers that aren't in the physical organization?
Absolutely. So not only is it incumbent upon the teleworker to practice good cybersecurity, the IT and cybersecurity staff needs to enable them to be able to work in their home and remote environments safely. And so that's also providing security awareness training that encompasses working from home. In addition to that, the hospital staff that works from home, they should use the practices that they would use within the hospital at home. So making sure that their machine is patched and up to date if they're able to use their own personal workstations in a bring your own device type scenario. Making sure they're patched, making sure the antivirus is up to date, uh, watching the websites that they visit, and ensuring that persons that are not employees of the hospital, like kids and that sort of thing, are using their laptops for personal use.
Very interesting. These are all really great tips for our viewers. So how does an organization know when they're prepared to deal with ransomware, is if ever?
An organization is rarely ever prepared to deal with ransomware. You answered it correctly. It's an iterative process, and it's ongoing. What organizations should be focusing on is reducing the likelihood of a ransomware attack through some of the techniques and procedures that I described to you before. It starts with the employees and building up that human firewall through security awareness training. It's also a combination of policies and procedures and establishing the direction for your staff and employees. And then it's also finally secured through the technical controls that you implement to help protect your employees from malicious emails or attacks that they may themselves not see.
Great. So it looks like we have a few more minutes. And one thing that we write about a lot in healthcare innovation is the idea of getting the board on board to invest in cybersecurity. Do you have any tips for our audience today about how to talk to the people on the board about the importance of protecting the hospital from ransomware.
Yeah. So the best way I have had success in my career is by using a risk-based approach and by using compliance frameworks like the NIST-CSF and high trust framework that I mentioned before, and showing how the risks and let's back up.
Okay.
Ask one more time.
One thing that we write about and discuss in healthcare innovation a lot is how to get the board on board, so to speak, to invest in cybersecurity strategies. How would you talk to a board at a hospital about, the dangers of ransomware and really investing in protecting the hospital?
Sure. I would use a risk-based approach when addressing the board. Uh, Quite often, when you speak to executive leadership and you start talking about bits and bytes, and you get into TCP/IP and you start talking about RDP protocols, their eyes start to glaze over. However, when you start using a risk-based approach and you talk about the impacts on patient care and how it impacts the branding of the hospital, then you have the executive leadership's attention. And then by establishing a clear plan to address those risks and demonstrate how you can clearly reduce the likelihood of some of those attacks taking place, and making sure that they clearly understand that one solution that you purchase or that the hospital invests in is not going to be the silver bullet that stops ransomware, but just constantly assessing, showing your progress that you're using to address the risk that ransomware introduces into an organization. Slowly but surely, you gain the trust of the hospital and the executive leadership, and they enable you with the efforts that you're taking to stop ransomware.
Great. Unfortunately, we're basically out of time, but I want to thank you so much for joining me here today, Fred. This was a great conversation, and I think you gave us a lot of valuable information.
Thank you. It was a pleasure speaking with you.